The biggest issue healthcare-wise in my assembly district is really access to care and getting doctors and nurses to move here. It's really difficult. And consider that the fastest growing demographic, age-wise, in our community is 65 and up. So we've got folks that are retiring and aging into that, and then we've got folks moving in from other places to retire. We have massive shortages in our healthcare professionals around here. Everybody's nodding, so you probably have seen this. One of my kids is type 1 diabetic. We drive her to a pediatric endocrinologist in Fresno every 3 months for her appointment to make sure everything's on track because there aren't any pediatric endocrinologists anywhere in our county. And that's just one little niche area of specialty care. So we need primary care, we need specialty care. And I've talked to all sorts of hospital administrators and recruiters for doctors. They say, Jordan, every December, some doctor from Michigan calls me and wants to move to come work at Miriam or something. And then they, because they're tired of the winter, right? They're done.
Until you can get out of there in droves.
And then they go, wait a minute, I'm making $250K instead of $500. And the house that I like in Michigan, if I were to buy it here, if I could even get it, would be $1.5 million. And then I've got all the other expenses of California living on top of that. And he's like, we can't get them. And I don't know what to do about that. It's a long-term project. I think there are things around the margin that we can do to improve it. And I do think that we need to free up the market a little bit and make it easier for small businesses to pool in order to lower the cost of insurance. I get it. Before I got elected, our number one overhead at my law firm was our health insurance. And it was going up like 20% a year. And you just wonder where does this end? I do have kind of an interest, this is more on the federal level. It occurs to me that it is a moral good to say that that people with pre-existing conditions should not be denied health insurance. I have a personal vested interest in this. One of my 4 children has a pre-existing condition. So I get that. The way they went about it on the federal level is to try to compel people to buy the product through the mandate, and then use that money to cross-subsidize to cover essentially folks with pre-existing conditions. There are other ways to do that. You could just say, hey, if you have a pre-existing condition, we want to make sure you have healthcare coverage, allow them to buy into a Medicare type plan or something like that. So, that's not a very Republican answer because we tend to be, what do you mean public option? That's socialism. I don't know. But, if it's a good for, and then that would hold down the prices for premiums for everyone else. If you had the pre-existing condition folks had a public option, then I think you'd slow the growth of, perhaps, it would at least probably help in my view. But that's, so much of this is dictated on the federal level. It's just, they fund so much.